Hi, my name is Dr. Jasmine Thum. I'm a neurosurgeon here at UAB and I treat epilepsy. In this video, I'm going to explain laser interstitial thermal therapy, or LITT, what the surgery involves, and what recovery looks like afterwards. LITT is a minimally invasive procedure that uses a thin laser probe to heat and treat the area of brain tissue where seizures begin. The surgery is performed under general anesthesia, so you are fully asleep. You will have two small incisions on the side and back of the head on the side of the brain causing the seizures. These are closed with absorbable sutures and will heal on their own. If the sutures have not fallen off before your follow-up visit about 2 weeks after surgery, we will remove them in clinic. You will also notice two small puncture sites near the top of the forehead. These come from the frame that holds your head still so we can precisely target the regions of interest. The procedure typically lasts several hours. Because of the length of surgery, you will have a Foley catheter placed, which will be removed the next morning. After surgery, most patients experience a headache around a 5 or 6 out of 10. This is common. Swelling is usually greatest during the first 3 days, and so oftentimes this is when headaches will be the worst. You will receive steroids and oral medications to help control this. It is important to take your steroids exactly as they are prescribed, along with a proton pump inhibitor, or PPI, which protects the stomach lining and helps prevent ulcers. Some patients may experience temporary double vision. This usually resolves over several weeks. If you're having significant headaches at home that are not being treated with the steroids or with the oral pain medication that we send you home with, please let our office know. You will stay overnight for monitoring and imaging to confirm there's no bleeding after surgery. Please continue taking your anti-seizure medications exactly prescribed after surgery. We won't know if the surgery is effective or not until about 4 to 6 weeks after the procedure. At this point in time, your brain has settled down and we'll have a better sense of whether or not the surgery has worked. You can usually resume normal activities about 5 to 7 days after surgery. I recommend walking daily, if able, to help prevent blood clots or any lung infections. After we have a better sense of whether or not the surgery has been successful, your neurologist will let you know whether or not it's okay to start weaning anti-seizure medications. However, this is not typically done until at least 6 to 9 months after the surgery. If you have any additional questions, I would be more than happy to answer them in clinic when you come in and see me. Thank you very much for choosing UAB for your care, and I look forward to meeting you in person. Have a great day.